I am a medical oncologist, which means I use medication in the treatment of cancer. And unfortunately, today, we can only claim cure in a very small minority of tumors when we use only chemotherapy. So one of the biggest problems, in my opinion, is that we are not using the right modality for cancer. Cancer is a systemic disease, is a disease that has the ability to invade tissue and be elsewhere. And the best treatment available now is a surgeon's knife. So there's a dichotomy here, is that we're not really approaching it correctly. Not because surgery is not good, it's because chemotherapy is not good enough. The chemotherapy or medical treatment so far of cancer is really quite disappointing, especially if you contrast it with the amount of effort and funding and money that is spent on it. The results are not going to be very good. However, today, this is what we have, and we are offering it to patients. As I was thinking, what can I say? I would probably say that I consider myself a non-conventional medical oncologist. By that I mean, if you put me among other medical oncologists, they usually don't like me because I criticize oncology. And I criticize because I really think we need to do much better than what we are doing, not only in terms of the outcome, meaning that we're not happy with the outcome. I think the more important reason for this is there is the ingredient for improvement. We are just not using it. That even is worse than when you don't have ingredients and then you just happen to be living in the wrong time. So I do believe that biologists actually are teaching us things, but we are just not learning. We have new insights, we just don't incorporate them. Why not? Well, this is a system problem. Among that is the way we train, the way we practice, the way our practice goes in daily settings and so on. Another thing that I thought will be very relevant to some degree is a very interesting quote that I love of Einstein. He says, if the facts don't fit the theory, change the facts. Now, if you really stop for a minute, it's very deep, actually. It means two things, at least, to me. One, there are so many things floating around. We think they are facts, but who said they are facts? We have to really challenge them sometimes and re-examine that. But the more important thing in my read of this is that a theory is very important. We cannot live in a complex life that has a lot of variables and not develop an understanding, a mechanism, which is what Dr. Chambers said. It's extremely important, irreplaceable, to have a mechanism. This idea of randomness and keep trying and in a very non-specific, very empiric way is a wasteful energy, in my opinion. And unless you know what you're dealing with, and unless you understand, you cannot improve. You can guess what might be better, but you're not going to plan to be better. So it is extremely important that the clinicians be exposed to this way of thinking so that they are itching to know the mechanism. And unfortunately, that's not the case. In fact, we almost brag that we are able to handle lack of understanding, and we call that wisdom or art. But the reality is we don't understand, and we don't try to understand, and we just became tolerant to this idea, so we're actually okay with it. In fact, we might smile and say, it's okay, you know, you just need to be with us a bit longer, and you will be like us. So I feel this is really a problem. We need to change, we need to challenge. That might be a sample of why you can tell my colleagues sometimes don't like what I say because they feel like I'm putting them on the spot. Anyway, so this is what I would probably say for now to start the discussion, and I'll be happy to be challenged. I'm completely democratic. You can disagree with me and you'll be fine. So any disagreement is welcome. Thank you.